In the second part of our interview with Dr. David Morrow, he discusses his patient Brenda Puglio's full facelift procedure and her new rejuvenated look.
Brenda is in her 50s, and she presented as a person who had not had prior surgery and really needed a lot to do what I call the 50,000-mile maintenance. That basically everything had fallen. We worked on an excellent plan of understanding every part of her face. Upper face, mid face, lower face lift, neck lift, and understanding her facial balance. Her balance was much heavier at that time preoperatively in the lower face and the neck and less in the mid face. And very subtle asymmetry of the brows and a very heavy neck. So our surgical thinking and our surgical plan here was to fix each and every one of those problems, and did. Her upper face, her mid face, her lower face lift, her neck lift, major malar, submalar combined implants mounted on her bones, and defatting of her face, of the lower face, above the muscle and inside of the cheek, and then partial peel. All that as phase 1. Phase 2, upper eye surgery and pulse light and YAG laser for her skin. You absolutely cannot find her scars, and she looks great.
Dr. Morrow did a full facelift and neck lift for me in February, and I've been extremely pleased with his work. He did a wonderful job. My sister just came out from Massachusetts. She hadn't seen me since I had it done. And I was really, anticipating her arrival. And when she saw me, her mouth just dropped open, and it was like, oh my God, you look wonderful. I mean, my neighbors, every time they see me outside, it's still like, you just look fantastic. If anyone's thinking about doing any kind of cosmetic surgery, I would recommend the Morrow Institute highly. One thing that Dr. Morrow offers that no one else did out there in the industry is for 1 year after your surgery, if you're not happy, he's going to take care of you. And when you come back in, he asks you every time, is there anything else you'd like me to do? Are you happy with what I've done for you? What can I do? Which is incredible. I mean, you see other doctors, they do your surgery, and that's it, you're done. You come in, if you don't like it, well, we'll do another surgery, but it's an additional fee. And Dr. Morrow takes care of you for 1 year. I would highly recommend anybody coming here. The staff is wonderful. I mean, I feel like I've made friends here, I mean, I come out for a weekend and I have to stop in and say hello to everybody because I feel like they're my friends, not just, the staff and Dr. Morrow, and, they're more like family to me. It's incredible.
I do not guarantee results, and you're not allowed to, and you can't by law guarantee anything in medicine and surgery. But what I tell patients, and put it into writing, is that we will take care of you for anything that I have done for a whole year post-operatively at no charge, in order to get it right, or as right as it can be. And I tell them up front that I do a lot of surgery. I'm no novice. I have never made anybody look fakey, never made anybody look too tight. It's always better to have that extra comfort level, and that gives you, the patient, and me as the surgeon, that extra comfort that, look, he's going to do his best, and if at all, he'll err slightly on the conservative side. If we need to do more, then he'll do it anytime in the first year, and that's no charge. That's nice.